1 year ago, I stood on the National Mall in the shadow of the Washington Monument. And I told you that people had suffered for far too long in the shadows and that we had to change that. I told you that I had met mothers and fathers whose hearts were breaking as they buried their own children who had passed away from overdoses. I told you also that millions of people who need treatment cannot get it, and that we must change that too. And as I stood there, I promised you that in 2016, that we would issue the first ever Surgeon General's report on drugs, alcohol, and health. And I am here today to deliver on that promise. And this has been a long time in coming, but this is an important day. And for me, this day is a personal day too, because I come at this not just from an intellectual standpoint, but I come at this from a place of emotion and feeling that has been informed by my experiences as a doctor, caring for many patients over the years who have lived with substance use disorders, who have struggled with addiction. I saw so clearly in my practice of medicine that addiction doesn't just affect an individual, it affects their family and their friends. And I remember vividly the faces of the mothers and fathers and brothers and sisters, the sons and daughters, who looked anguished and guilty as they told me the toll that their suffering was taking on their family members. They wanted to overcome their addiction, but they didn't know how. And that's why I am so glad to release this report today, because it turns out there are many sources of hope. In this report, we call the country's attention to the fact that substance use disorders are, in fact, one of our most underappreciated and underaddressed public health crises. We have 20.8 million people in America with a substance use disorder, which is similar to the number of people who have diabetes, and is 1.5 times the number of people who have all cancers combined. But only 1 in 10 people with substance use disorders actually gets treatment. And I want you to imagine how our country would react if only 1 in 10 people with cancer could actually get treatment, if only 1 in 10 people with diabetes could access treatment. We wouldn't tolerate that, and we shouldn't tolerate it for substance use either. The other point, though, that we make in this report is that there are reasons to hope. And those reasons to hope come from science, which tells us that prevention and treatment strategies do in fact work. We have strategies that can reduce the risk of overdose, we can reduce the risk of relapse, and can help people live fulfilling and productive lives. And in this report, I call on our country to ensure that everyone who needs access to treatment has it, and to make sure that we are embedding prevention programs in all of our communities so that we can protect our kids in particular. We know that adolescents are particularly at risk for developing substance use disorders. Their brains are still developing. And if you begin using alcohol at or before the age of 15, your risk of developing an alcohol use disorder is 4 times greater than if you start at the age of 21 or later. There is also a marked risk of developing addiction to illicit substances when you start during adolescence as well. So we have to focus our prevention efforts particularly on our kids. But perhaps the most important and difficult thing we call for in this report is a cultural shift in how we think about addiction. For far too long, people have seen addiction as a disease of choice, as evidence of a character flaw, and at worst, even as a moral failing. But that is absolutely not the case. Science tells us clearly that addiction is a disease of the brain. It affects the circuitry in our brain and impacts the areas that control decision-making, impulse control, and our stress and reward system. When we understand that, we understand the biological basis for why relapse is so common and why it is so hard to resist the cravings and to deal with the withdrawal symptoms of addiction. We have a major challenge ahead of us. But I have never been more confident that we can overcome it than I have been today and in the days preceding today, as I have met community members and advocates and families who have come together to help us turn the tide on the addiction crisis in America. And we can't do this alone. This is going to take more than doctors and nurses, more than public health experts, more than policymakers passing laws. It's going to take mothers and fathers talking to their children. It's going to take educators implementing prevention programs in their communities. It's going to take doctors and nurses ensuring that they have the training to screen for and diagnose and treat substance use disorders, which doesn't happen often enough today. We have an opportunity today to start turning the tide, but I know we're here to talk about this report that I am issuing, Facing Addiction in America, but really, the truth is that we are here because of something much bigger than this report. We're here because of the sacrifices that so many of you have made. I know that standing up and telling your story is not easy, especially when you know that you may subject yourself to the cruel judgment of others. But despite that risk, men and women all across our country who have a substance use disorder have stood up to shine a light on this problem and to tell our country that we can no longer ignore the suffering of millions and millions of Americans. And that courage is what has allowed us to come to where we are today. You know, we are here to talk about addiction, but the truth is this is about more than addiction. This is about the kind of country that we want to create for ourselves and for our children. A country where people can live with dignity and respect, regardless of their life experience and background. A country where people who need help can get it. That's the kind of country that I want for us and for our future generations. We've started on a journey today, but this journey will not be complete until we ensure that everyone who has a substance use disorder can come forward and does not have to live in shame. Our journey doesn't end until everyone who needs treatment can actually get it. Our journey doesn't end until we ensure that as a country, we are coming together to value each and every life. And our journey doesn't end until hope replaces despair, until love ultimately overcomes fear. That's the journey that we're on. And I want to tell you that as your Surgeon General, as a fellow citizen of America, as a resident of this planet, I could not be more proud to stand with you, shoulder to shoulder, on every step of this journey. So thank you all so much for everything you have done. I appreciate you.